All right, so for the next item I'm bringing forward, I'm really pleased to provide the board an update on our first, not our last, but our first telehealth clinic, which we know is at Glen Elementary, as well as plans to implement a hub system related to our full service community school effort that has been underway for a number of years and growing. So pleased to have Adrienne Cole Johnson here, our Chief of Family and Community Engagement, who will kick off that presentation. Adrienne.
Thank you, Dr. Cashwell. Greetings, Chairwoman Shea and members of the board. As Chief of Family and Community Engagement, I am honored to stand before you this afternoon. During this time, I will provide updates regarding our Community Schools Initiative, in particular, the new Glen Telehealth Clinic, and progress updates on the first full-service community school site for Henrico County Public Schools. During my last full school board presentation in May of 2021, we shared general updates for the Community School Initiative. Yet this is a great opportunity to share additional detailed updates, approaches, and happenings since then. I love to start with a refresher of sorts regarding what community schools are and why this national model is great for Henrico. A community school is a public school, the hub of its neighborhood, uniting families, educators, and community partners as an evidence-based strategy to promote equity and educational excellence for each and every child. It is also an approach that strengthens families and communities, promoting vital resources and connecting students and families to services that can help them thrive. As we consider the community schools approach, there are 4 pillars that set the foundation for success. They provide the most current and relevant ways to ensure the proper protective factors are in place while using a whole child, whole family approach to 21st century education. Integrated student supports that link students and families to a range of health and wellness offerings with the aim of removing out-of-school barriers to learning. Expanded learning opportunities that highlight the value of providing additional programming before school, after school, or on weekends. Collaborative leadership and practices, embodying a spirit of collective impact as we lead and learn together and share the responsibility for student outcomes. And last but not least, family and community engagement, ensuring high-impact strategies that place parents, caregivers, and community leaders in position to enrich our students' lives. The Henrico County Public Schools' belief in the right to achieve and the support to succeed for all truly lives in this model. Studies have found that the community school or full-service community school approach has had a positive impact on student attendance in elementary, middle, and high schools, has had a positive and significant impact on elementary and middle school students' on-time grade progression, and suggests a reduction in disciplinary incidents for students. In addition, but just as importantly, well-implemented community schools lead to improvement in students and school outcomes and contribute to meeting the educational needs of students that may be struggling in lower socioeconomic areas. In addition to the vision, this effort is in full alignment with the 4 cornerstones, in particular, the strategic goals of fostering an inclusive, safe, and supportive climate, as well as our goal of cultivating and maintaining meaningful collaborative partnerships. What this looks like is a hub and spoke model with our schools well-positioned and connected with local partners and in regular collaboration with staff, families, community, and business partners. This also looks like full-service community schools throughout the county that are open to students and families. The spokes or schools are accessible during school hours, and while out-of-school time is often present, it may be limited. Traditional school space is available for programs and services, and there are offerings to support most students enrolled in that school. The hub can be viewed as a more robust, deeper extension of what our community schools look like. with accessibility after school, on weekends and summers, services for the entire community, and additional space outside of traditional space. As HCPS has moved along this path, we've had the pleasure of launching the first spoke in our wheel, the Glen Telehealth Clinic. In 2017, Community Health Status Assessment, CHSA, assisted community members, health and service providers, and elected officials in learning about health trends and disparities in the community, determining priorities among numerous health issues, prioritizing resources and planning, and taking action to equitable improved health in Henrico County. From this assessment, a partnership grew between HCPS, Henrico Education Foundation, and VCU Core Health that focused on the effort to bring the first health clinic to the county. Through this partnership, the work of making this vision a reality has taken place, which led to the launch of the Telehealth Clinic on November 30th, 2021. Based on the data analysis, Glen Elementary School was chosen as a pilot program for a telehealth clinic that will provide the following: medical services, dental services, and mental health support for students and their families. This innovative initiative significantly highlights one of the 4 pillars of the community schools model that was discussed earlier: integrated student supports. Let's take a peek at how things are going at the Glen Telehealth Clinic.
Hi, I'm Tamika Campbell, serving as principal at Glen Elementary, and I am here in our telehealth clinic, coming to you to just talk to you and let you know how we continue to be excited about the opportunity to serve our students via telehealth services. Our students are going to be able to benefit from the telehealth clinic by telehealth services, and you can see the monitors here. Our staff remain ready to serve our students through the telehealth clinic. We are excited about the opportunity to be able to reach out by web camera in order to talk to a doctor on the other side. And that is how our students are actually going to be serviced. Our nurse would come in, and if the nurse determines that our child needs to see a doctor, then they will get online with the doctor through VCU, and one of the doctors who we're in partnership is going to have the nurse assist with seeing the child, providing the vitals, and then making recommendations for the child's medical care.
Hi doctor, how are you today?
This is going to help our families in tremendous ways, of course. Having this service is going to support our families who have difficulty with transportation. It's going to help our child, most importantly, get the medical assistance faster, which we hope they will heal quicker and be ready to learn, and they'll rule out some things so that we can get them back to class sooner. This has been a great collaboration project between our family engagement team, with our central office team members, and members of VCU. We're just excited about the partnership and start to continue to grow the opportunity for our families to take advantage of this awesome opportunity.
Hello, my name is Hattie Crawley, and I'm the family advocate of the Great Glen Lee. And I'm here in our telehealth clinic that has been set up, and this has been set up to assist the parents and the families in our community to empower them with the knowledge of health information. The reason why that it is here, like I said, to empower them, we have some students that from day to day will come in sick, but if they can use this particular resource and this device, it will enable them to maybe stay in school a little longer and continue learning, continue their education. Also, I would like to give a great shout out to Ms. Jones and Ms. Rawlins, who have gotten to know our students here and our families, and just assist them with the knowledge and the wealth and the health of their information.
Hi, I'm
All right. So collaboration for innovation has truly been a theme for this project. I know that the staff has been working extremely hard to continue their engagement with this project, and so a special thank you to the great Glen Tigers for their commitment to this initiative. Another huge thank you to our amazing partners. The weekly calls, training, and partnership has been amazing. Partnership is really highlighting the unique skills of all for shared outcomes, and this is exactly what has been on display. I believe our good friend Mike Taylor is here in the room. Mike. And I would like to give him a mention for being right there alongside us on this project and so many other projects that we have here at HCPS. So a big thank you to the HEF team for your investment of time, effort, and resources in our students and families. During the ribbon cutting, we were able to hear from some of our students, and I've taken a few words from one of our students, Jane Nair Karanyaha. Our thank you to partners is not only from staff and adults, but also from our students who are glad they've had this opportunity at Glen. Next up in my presentation is the Full Service Community School Initiative at 15 South Oak Avenue, the old Highland Springs building. One major update is our renaming of the space so that it may have an identity of its own. I am inserting a drum roll and slight suspense here. The Oak Avenue Complex. The Henrico team is beyond excited about efforts around the Oak Avenue Complex. The name is an effort to bring together the geographic boundaries of the area steeped in the meaning of an oak tree. The oak tree is one of the most loved trees and is a symbol of strength, morale, and knowledge. And it's often associated with honor and wisdom as well. When we pondered on what this new initiative will mean for our community, it absolutely fit. So moving forward, we will refer to the old Highland Springs High School as the Oak Avenue Complex or the Oak or possibly the OAC. We are still figuring that out. So as an extension of what has been shared, this slide illustrates a bit more of the differences and detail of the full-service community school. The goal is to embody as many of the listed areas as possible for optimal support, whether we are discussing youth development activities, college, career, and citizenship, community engagement, or health and social services. The more components, the better. There will be a full-time resource coordinator on site to ensure that all aspects work together. I would love to recap our listening tour. The Family and Community Engagement team had a blast this past fall out and about in the community. We participated in over 25 school events, hosted informative virtual roundtables, and attended various community gatherings where we were able to collect written feedback from 243 community members, although we talked with hundreds more. It was great to learn from our neighbors and to get a true pulse of the interest. While we attended several events, the majority were in the areas most proximate to the Oak Avenue site in our Varina and Fairfield districts. We received much information, but I wanted to give a high-level share of some of the questions and answers that stood out during our listening tour. First, what services and programs will be most helpful for students? Responses were in alignment with what we intuitively anticipated, yet it was helpful to have this confirmed from the community. This slide shows the areas where respondents felt the services were either extremely helpful or very helpful. Enrichment, clubs, counseling, and STEAM were all high on the list. Academic tutoring and after-school activities as well. These services and programs will be prioritized as we align components of the Oak Avenue complex. What supports are families looking for? In receiving input, we wanted to know what some of the perceived challenges and opportunities were in the community. This slide highlights responses of 25% and higher and also gives us a peek into the type of support that should be at the Oak. While many of these are not surprising, we are well positioned to collaborate with partners to best address these needs. Family stress, mental health concerns, and safe after-school options are just a few. This last share, similar to the first, zeroed in on what parents and caregivers would be interested in. We know that the whole child approach is best supported when adults are also whole. Academic supports, youth development, health and wellness, and financial planning are just a few that were mentioned. We were encouraged to see interest in bridge opportunities where educators and caregivers are able to connect with each other regarding their students. Again, this listening tour was informative and very helpful as we chart the details of how the Oak Avenue complex will form. Next, what are we doing to get there? We are working intently in parallel paths to open doors to the Oak during this calendar year, with the focus on stakeholder engagement, operations, planning and design, and implementation. We are confident that we will get there with adequate collaboration throughout the county. Our first quarter focuses on partnerships and collaborations. Continuing this work, we are connecting with various HCPS departments, Henrico County agencies, and community partners who can rise to the services and programming of interest to the community. A special mention to Lenny, Susan, and our facilities team, as they have started to explore what is needed to ensure all components work together. Program planning has begun, and this month we are beginning district-based work with various stakeholders as we outline our design. Lastly, implementation. We are looking at a staggered approach, starting with the soft launch of the partnership-based components that will be led by family and community engagement. The goal is for spring of 2022. This will be followed by an official launch in fall of 2022 with our learner-based approach. It is also important to keep in mind that we will grow into this space, remaining nimble and responsive to the needs of the community. To conclude, we will end with our why. Why community schools in Henrico? As we forge ahead through this pandemic, understanding that it has illuminated our opportunities for increased coordinated services, we are doing all that we can to remove barriers to learning with an equitable engagement lens. This effort allows us to do this while still supporting the HCPS strategic plan. As always, thank you for your time this afternoon and for your ongoing commitment to the students and families of Henrico County. I welcome any questions or comments.
Well, thank you for that presentation, Ms. Cole Johnson. Who would like to start? Let me see. Reverend Cooper, it's between you and Ms. Atkins. How about you start us?
All right, so thank you so much, Ms. Cole Johnson, and to Mike Taylor and the team for always the excellent work that they do. And I'm excited about the continued opportunities that Glen Lee provides, especially to the Fairfield District, and the model that it will be for our expansion of the program, as well as our community-based schools. So thank you again for the update. Look forward to hearing more and to see more as far as the evolution of it. So 2 questions for you. At our Glen Lee Telehealth Clinic, the school nurse and the Children's Hospital of Richmond provide the medical services. VCU Dentistry will provide the dental services. The question I raise, is there a provider secured who'll be providing the mental health supports? Is there a timeline for launching the mental health services?
I will do my best to answer. I'll look at my partner as well, Leslie. But absolutely. So we have a liaison with schools through Henrico County Mental Health that is really staying connected there. We've been in really close communication with our mental health and wellness team within HCPS, and also the work around our trauma-informed specialists. I have to shout out Amy Johnson, who's been right there along with this project as well. Is there anything else to add?
Nope, I think you did. I think you did an excellent job. To answer your question, Reverend Cooper, that is something that we've talked about on our roadmap. As you said, right now we have the medical health and we have the dental health, and we would like to have some mental health on the horizon, so we are looking into that. But in the meantime, we'll follow our same procedures where our school-based mental health team, our counselors, our school psychologists, and social workers will continue to serve the students in the school, working with their mental health liaison from the county.
So are we saying that right now, we're going to handle it internally.
That's correct.
Is the goal to bring in an external mental health partner as we've done with medical and dental, or do you foresee us trying to continue to do it internally?
Right this moment, we'll continue to do it internally, but it would be our goal eventually to look to that end. And Dr. Cashwell, I don't know if you have something to add
I
as
think you all
well.
have covered the main points. I would add, just in talking to our team with VCU Health, this is a portal to that initial connection with the physician, but just like if you went to a physician's office in person, they might refer you to other services. And so in some cases, it might be that through this connection, a child is referred to other mental health resources that might be necessary outside the school day. But as the team has indicated, we do have a number of resources right there at the school. I know some of the early work with the school at Glen included having a representative from SCAN, is focusing very much on that trauma-informed care added to the team there. So a lot of layered support there in the school for mental health. And I think as far as the telehealth clinic, it also provides an opportunity, should a student have a unique need related to mental health, that the VCU's physician could also make referrals. So I think there are a number of connection points.
No, I appreciate that, and I look forward to hearing about the current and then the possibility in the future. So thank you, Dr. Hughes, for that input as well. Thank you, Dr. Castro. And Ms. Cole-Johnson, do you know what type of data we're going to collect to assess the efficacy of the telehealth clinic on improving student absences, improving health outcomes, et cetera?
Great question. And so I know that the HCPS team and also a few other partners in Henrico have really explored and looked at a few different locations and what they're doing. We're really looking to just follow the national trend of how often are students coming to school, really looking at that time in between, even if they're able to stay in school after being seen in the clinic. We could absolutely pull that information for you to see what we'll be looking at, but definitely looking at some consistent indicators that others are doing as well.
Definitely love to see the data. And I think too often we assume that outcomes are being affected, but we cannot definitively define the efficacy and the importance of scale in regards to helping us mitigate some of those current trends that we're seeing. So thank you for that.
Thank you.
Madam Vice Chair.
Thank you, Reverend Cooper. Ms. Atkins?
I am so excited, Ms. Cole-Johnson. Thank you so much, and your team, and the many individuals that are part of this effort. There are more that want to just jump in and be a part of this effort. It's a historic effort. I want to say congratulations. You are at the mountaintop. However, with that said, when you're at the top of one mountain and you look up, it's time to climb the next one. And so I'm so grateful for listening ears. There's power in the name, and the name reflects the history. And so I think that the community and the communities that surround Highland Springs are going to be very pleased with the presentation that you shared. It was well done. So I want to make sure that you hear that because communication is going to be a priority in this effort. As with any effort and with many efforts, communication is always going to be impactful. And the way in which we communicate the oak is going to be critical in this space. I have several questions. The first one is a great segue, is around communication. As you are defining the communication timeline, I wonder if you've received feedback from the community on the best ways to communicate. This is innovative. This is new. I'll say it again. This is also historic. And I think it would be wise to ask the community, as HCPS, we have ways in which we communicate. We have the template of disseminating information. I wonder, in your expertise, if we were to ask the community, I know our family advocates and many others are always in the community, including myself, to really just pause and ask around the best way to launch, the best ways to communicate as well, in addition to what we would normally do within HCPS. Is that something that you've had conversations on at all?
We've thought about it, but I really like your intention of saying to ask the community. When we did our listening tour, we were intentional about getting emails and phone numbers. Folks wrote in a lot of comments that were really helpful, but we were intentional of collecting their info. And so what we plan to do is to start there. The data that I just shared with you all, we want to just condense a bit more, not only email it out to folks who responded, but also if we could have something interactive. I'll be connecting with our communications team around that. So a short video, we've been doing a bit of that throughout the listening tour too, just to update individuals. And also we know that sometimes hand-to-hand is the best way to really connect with folks who are not as connected digitally. And so we want to ensure that we can get even a 1, or 2-page overview of the feedback that they gave us so that they know that we're listening to them, we're hearing them, and that we're applying it moving forward.
Thank you for that. I would like to offer, as you look at communications, I know the internet is one powerful way to reach, where you'll send emails. We have our website. I know we use social media. To me, that's all one touch point, one approach. But I'd like in this space to use all 5. I'd like for it to be, of course, which you and your team do very well, face-to-face events, as well as the electronic ways we communicate, as well as some level of a handout, something that folks could have in their hand or put on the refrigerator. And then last but not least, voice via phone. So as you are pondering your communication plan and strategies in this space, I'd like for us to utilize all the touch points and to have a nice balance so that we're not putting all efforts into our electronic messaging and emails, but we're using all those touch points in this space. The other question is, if you could share, I know we did the survey, we got the feedback, some of that, of course, influenced your presentation. I also think it would be helpful for the community to see the responses. So it could be done in, a high level, and you can utilize whether your pie chart, your bar chart, your 3D charts, whatever way you choose. But I think it would be helpful for the community to see the overall responses from the survey. I think it's impactful. I also think that it's a good way to empower so that folks can see the influence that we have is magnified. So I would hope that you would consider doing that in, I don't know which venue you would choose, whether it's a school board meeting or not, but please consider sharing the results of the survey and the time and effort that so many provided, just as you did today with the listening tour. Does that make sense?
Absolutely. That's the first stop in our communication plan, to make sure that we circle that back to the community. So thank you so much for that suggestion.
Wonderful. And then there's 2 more pieces, touching base just on data. So we know that this is going to be the first for Henrico County. However, it's not the first within the United States. I think also if we could take some of the data for some of the other areas that are doing this and do some level of a comparison so that we can actually give insight into expectations a little bit. Whether that's done, for all of Henrico or just if it's centered around the Highland Springs community, but to really understand what this means, because we have examples. I think it's smart to show what the examples look like so that there is a level of comparison. We can start setting expectations, etc. So also, if you would consider doing that, I think that would be very beneficial for folks who are trying to digest, well, what does this really mean? Great news. We can work smarter because we have examples to share.
Absolutely.
Does that as well?
Absolutely. Thank you.
Okay. And then the last thing is feedback around adding a museum into this space. Now, what that looks like, completely up to you and your team, looking at budget, funding, resources, etc., but really capturing the history, and absolutely you can relate it to the roots of the oak in Highland Springs, if you will, So in some way, shape, or form, making sure that that building includes some level of what I'm just going to use the term museum, but some way that we're capturing the history of the legacy of the community that this building is within. So those are my thoughts. I'm extremely excited. I am going to be on the ground. I was in the past, I am right now, and I will be in the future as we continue to sort of promote and explain what this means and the magnitude and the power that this is going to have for the community. So thank you so much and your team for all of your work.
Thank you.
Vice Chair, that's all I have.
Thank you, Ms. Atkins. Ms. Ogburn?
Thank you. Just real quick, I noticed in the chart that you shared about what family supports families are looking for, couldn't help but notice that besides reading and math, it's covered up a little bit, obviously, by our virtual screen there, but mental health issues and family stress are right up there at the top of what people are asking for. And obviously, right now, it's such a stressful time for families. And so I'm so glad Reverend Cooper brought up the mental health issue and talked about that a bit, and that we know how that's going to be meeting the needs of families. And such an important thing, especially now during the pandemic. I think we all hear it all the time about how stressed our kids are, how stressed families are. And I mean, I think we would be lying to ourselves if we thought it wasn't a stressful time for all of us. And so I'm so glad that you did this, and you can see what are the high priorities that we need to be stressing. I mean, we were all there for the opening. It's such an amazing site, this community health clinic. So just as the board's representative to HEF, I will also highlight that Mike Taylor is here and thank the HEF for all the work that they have done to make this a reality. I remember being in a meeting a few years ago when the idea was tossed out. I know it's been this, they've gone and looked at other sites. They've learned from people who were doing this before us. And I just think to see it come to fruition is such a gratifying thing. And I think there's a lot more planned beyond the oak. That's going to be exciting. But thank you for all you're doing, and thanks to the HEF and to the HEF board.
Absolutely.
Thank you.
Thank you.
Thank you, Ms. Ogburn. Mrs. Shea, Chair Shea.
Thanks so much, Vice Chair Kinsella. I just start with a shout out to Ms. Cole Johnson and Mr. Taylor, who are truly the champions of meeting our families and our students exactly where they are. And this is just another great opportunity. As Ms. Ogburn mentioned, this has been a multi-year process, a long time coming. Ms. Atkins and I were able to go with Dr. Cashwell and HEF to see a site in South Carolina back in the fall, and really have some frank conversations with a school there and how it has impacted them in positive ways, and learn from their challenges. And so this has really been a tremendous effort across the board. I also think as we look at all the things that we've learned in the last 2 years, we know that these needs are not just in single acute geographical areas in our county, they are widespread. And so as we look at expanding this hub and spoke model, it's really going to touch all of our districts across the division and be so important. Just the one question I have that I've gotten some questions from my constituents about, and this is kind of for anyone on the team. I'm not trying to put you in the hot seat, Ms. Cole Johnson, but as we look at the financial sustainability of this, particularly the healthcare piece of this, can you talk a little bit about kind of how the funding, how the startup funding, and then kind of how the billing for the health provisions works?
Absolutely.
In a broad sense.
Yes, great question. One thing about me, I love experts. And so
Help is on the way.
I'm glad that Mike Taylor is here. They have really been leading us through this journey to make sure that we're positioning things in a way that's sustainable. So Mike, if you could share a little bit about that.
Absolutely.
Thank you.
Thank you, Dr. Cashwell, members of the board. So glad to be here with you today, and thank you. It's a wonderful partnership, and we're super excited to be part of it. So yes, there's several pieces. So first, we've been working hard on some of the fundraising pieces for capital needs around equipment, the exam tables, telemedicine equipment, cameras, the components and things that go into that. So the clinic at Glen, the equipment that is there now has been funded primarily through some of our fundraising efforts through a number of partners that helped with that. And we're working on additional funding pieces that will be for equipment, again, both dental and health needs at Highland Springs High School at the Oak Street complex. As far as, well, sustainability, there is the opportunity through VCU Medical School or VCU Children's Hospital and through the VCU Dental School for billing for services, both for insurance and for those that may be on Medicare, Medicaid. As far as copays and such, we're working to look at developing a fund that could cover the cost of that so that everyone can have access as needed at school, and that can be covered through some funds that would be available on the foundation side. So the idea that it would be completely accessible to every student that is interested, and every parent that has given consent and said, yes, we'd like to participate in that and take advantage of it, with the ability to cover any copay if it's necessary and required by insurance. But then again, the billing for services can move that into a sustainable piece. A lot of schools across the country that are doing this are able to do it sustainably because they can bill for services and do it in such a way that, again, kids don't miss school, you have less absences and students that are out sick or tardies because, again, all that can be taken care of right there at the school side. And again, I think there's a number of partners that are interested in doing that. And from the medical side, not to speak on behalf of Children's Hospital, but when folks aren't able to get these services at the school level, often they're using the emergency room as their primary care physician. So it is an expense to those medical providers. If they can come together and find a way to serve students in this way, then it frees up capacity in other places. So hopefully that was helpful, but we are committed to, again, helping create a fund that would cover some of those copays. And then again, for those capital needs that are around equipment, technology, to get the health clinics up and running to making that happen.
Another thing I would love to add to it is state and even federal government is really pouring a lot of financial resources into full service community school models. So one thing that's exciting about Henrico, as we've already started with our 21st century after school sites, is we're revving up for the full service community school. I mean, I think the number is maybe 243 million or billion that they put in for funding for full service community schools. So there's a lot of opportunity there. And I think the other thing that's really attractive about this model is the lean fiscal approach and really working across different agencies to provide services that we're already providing. And so the collaboration and the partnership really speaks to that when we're talking about the financial support for the project.
Right. Yeah, and I think that's right. Using many partners to do the work so that, again, it's not one partner covering the full cost. It's everybody bringing the services that they can provide, the support, whether it's, again, on the mental health side, SCAN and others that are part of that, all bringing those pieces together to serve it in the most cost-effective way.
Yeah, I think you're spot on there, Ms. Cole-Johnson, with the fact that there's a lot of synergy there between the social determinants of health and the social determinants of education. And so capitalizing on them and working with community partners that we all have these same goals for our students and our families, and they overlap. And so how do we make this happen? I think you're spot on there. And Mr. Taylor, I really appreciate the insight on really fundraising the startup funds, but then people also understanding that our providers are taking care of a lot of the billing side of things. That is not an extra layer for our own kind of school clinic people. That's being taken care of the providers who are familiar with those systems and know how to navigate that. So I appreciate both of you kind of chiming in, because we want this to be sustainable. And so it's a Herculean effort, and we want it to be successful. So that's all for me. Thank you.
Thank you.
Thank you so much, Chair Shea. I'll keep it brief just by saying thank you. And Reverend Cooper and I sit on the audit committee together, so I'm sure we're both pleased that the financial component, we just appreciate that being shared publicly, that there's not going to be, funds changing hands. Our financial folks in our schools' offices will not be doing additional duties. But most importantly, from an audit perspective, we appreciate that being highlighted. So thanks for that question, Chair Shea. I'm looking forward to not only this, we really enjoyed going and celebrating with Glen Lee. I'm looking forward to the Oak. That's what I'm going to call it, being opened, and then I'm looking forward to the expansion. I do have a question in terms of expansion because I know it's Virginia Randolph. When we rebuild Virginia Randolph, right? That's going to be our next great location.
Correct. Examining that site as the potential of a hub. Remember, the spokes, will be able to touch individual schools in each community, sort of like we've used the example with the Oak being the hub and then continuing to build that spoke system throughout the area. Similarly with Virginia Randolph, we've also looked at Quioccasin Middle as a potential hub site, and again, branching out with those spokes to make sure we're touching the whole community.
Well, certainly those needs exist across Henrico County. So just thank you for that. We look forward to updates and expansion soon.
Absolutely.
Thank you.
Thank you.
All right. Thanks, Vice Chair Kinsella.